Kia ora koutou katoa. Good evening, everyone. I want to start by acknowledging that Dr. Bloomfield has accompanied me for this press conference in order to answer any questions that may arise from this statement that I am about to make and the decisions that have been made by Cabinet today. It has been 53 hours since we moved Auckland into COVID Alert Level 3 and the rest of New Zealand to Level 2. This afternoon, Cabinet met to receive the latest information and advice from the Ministry of Health and to discuss next steps in our resurgence response plan, a plan with the primary purpose of restoring our Level 1 freedoms as quickly as possible. We have made a good start on that plan. This is what we know about the new infection in New Zealand. We have identified 29 cases. At this stage, all remain linked to one cluster centred in Auckland. One other case that is likely linked to the cluster is still being investigated. We have undertaken more than 30,000 tests in the last 48 hours. 38 people linked to the cluster are now in government-managed quarantine as a precautionary measure. There are signs we have found this outbreak relatively early in its life. While the first case we identified tested positive this Tuesday, extensive testing and contact tracing has since determined that the earliest case we have found to date was a worker at the Americold Cool Store in Mount Wellington who became sick on approximately the 31st of July. This may not yet be the origin of the outbreak, but on the information we have to date, it's the earliest sign of the re-emergence of the virus. In terms of the ongoing investigation to identify where the virus originated from, there is still no clear connection at this point. Contact tracing and genomic testing has not found a link to the border or managed isolation and quarantine facilities at this stage. The sequence of the virus from the current outbreak is not the same as the sequences from community cases in our first original outbreak in New Zealand. This suggests this is not a case of the virus being dormant or of a burning ember in our community. It appears to be new to New Zealand. In terms of wider surveillance, since I made the announcement to move alert levels on Tuesday, we have tested more people than in any other time we have had COVID in New Zealand. We have stock for a further 303,000 tests currently in New Zealand. The Level 3 restrictions and the speed in which they were implemented will have made a material difference in containing the spread of this outbreak. So will everyone's compliance with those restrictions. Auckland travel data yesterday, the first full day of Level 3, shows a 60% reduction in travel compared with the last 3 Thursdays, which is even less travel than at Level 3 last time, which just demonstrates the incredible job that Aucklanders are currently doing. This is also what we know. We know the incubation period for COVID-19 and our experience of previous clusters, some of which reached more than 80 cases, means we can expect to see more cases as part of this cluster. It will grow before it slows, and it may continue to be linked to schools, churches, and social gatherings as it has done to date. We also know, based on overseas experience and our own, that it is possible to contain a cluster or outbreak without ever being able to identify its origin. What is important is making sure that we establish the perimeter of the cluster and to stop it from growing. To do this, we do need to take into account that all-important incubation period. And so, in keeping with our precautionary approach and New Zealand's philosophy of going hard and going early, Today, Cabinet has agreed to maintain our current settings for an additional 12 days, bringing us to a full 2 weeks in total. Our current expectation is that by this time, the perimeter of the cluster will be identified, will be isolated, and we can move to level 2 in Auckland with confidence. That means Auckland will remain at level 3 and New Zealand will remain at level 2, the rest of the country, until 11:59 p.m. on Wednesday the 26th of August. We will, however, review these settings on the 21st of August. We want to give about a week's time to see how we are travelling before we review again. I would characterise our approach as short but precautionary hold and an ongoing investigation so that we continue to stamp out the virus. There is nothing to suggest we need to move to a level 4 lockdown at this stage, as we do not have a number of clusters or unrelated cases. I'll say that again because I've seen a lot of speculation. There is nothing to suggest we need to move to a level 4 lockdown. Cabinet also does not want Auckland to be in level 3 any longer than is needed to ensure the outbreak is managed. Our intention is that Auckland and New Zealand will quickly move back down through alert levels if we continue on this track. But it is wise to take a bit of extra time. That bit of extra time is our best way of getting out quickly. As always, the best economic response is a strong health response, and short and sharp is best. Lifting restrictions now and seeing a potential explosion in cases is the worst thing we could do for Auckland and the New Zealand economy. At the same time, level 3 does allow us to continue with more activity than a full level 4 lockdown, and I do think that's important to remember. Estimates are that the economy operates at roughly about 80% at level 3 compared to 60% at level 4. I am mindful, though, of the extraordinary disruption to business and the anxiety that this outbreak will be causing. As before, we will use what tools we have to protect jobs, incomes, and businesses, as well as people's health. To provide certainty to businesses and workers, I can confirm today that Cabinet has made an in-principle decision to extend the wage subsidy scheme to support businesses and protect jobs as we undertake the public health measures required to fight the virus. Finance Minister Grant Robertson will be working through the final details with officials and Minister Cepoloni over the weekend. But I can say that the extension to the wage subsidy will be nationwide and will cover the period of time that the current level 3 restrictions remain in place. Minister Robertson is here, and once Dr. Bloomfield and I leave the podium, he will take the stage to give a bit more of an explanation and answer any questions you have on that. I want to touch very briefly on the activity that continues in Auckland under level 3 with the appropriate health and safety protocols in place. Auckland Transport has 44 construction sites operating under level 3. Construction continues across 5 sites on our largest infrastructure project, the City Rail Link, with about 1,200 workers. The Employers and Manufacturers Association has said many food service businesses that closed during level 3 last time are this time adapting and trading on a click and collect or delivery basis. And houses continue to be built in Auckland. Kāinga Ora alone has over 150 projects with over 3,000 units under construction. All of this is happening because of the protocols on operating safely at level 3, which includes social distancing at work sites. If you have questions over whether your business can operate, please visit the COVID-19 website or contact MB directly. To summarise, as we have said from the start, our overall COVID-19 strategy remains elimination. That requires the ongoing stamping out of the virus any time that it comes back. Together, we have got rid of COVID before. We have kept it out for 102 days, longer than any other country. We have been world leading in our COVID response, with the result that many lives were saved and our economy was getting going faster than almost anywhere else again. We can do all of that again. 1.5 million New Zealanders in our biggest city are carrying a heavy load for our team of 5 million right now. But together, we will overcome an obstacle that we knew had the potential to come our way, which is why we have a plan, why we are rolling out that plan, and why we once again can pull together to eliminate COVID. So here's what I ask today. If you're in Auckland, please stay at home in your bubble. Wear a face covering whenever you leave your home. For the rest of New Zealand, use a face covering in places where you're close to others, like on public transport. Download and use the app and make sure you can quickly access all your movements for the last 14 days in case you are contacted by the contact tracers. Businesses, please put up your COVID tracer QR code posters. And everyone, wash your hands. Stay home if you're sick. And if you're unwell, get a test. We'll be checking in again soon, but till then, stay safe, stay kind, and stay well, everyone. We're happy to take questions. Jessica.
Minister, did you give consideration to an all of North Island level 3, given that we've had cases now outside of Auckland?
No, that wasn't something that was viewed as necessary, nor was it something that the Director General advised Cabinet was necessary. Of those cases that we have in the Waikato area, they have all been connected, they've all been contact traced, they've been tested, and they're in isolation. And that is part of our normal regime. We have to, of course, remember level 2 is designed to be able to coexist alongside a strong contact tracing, isolation and quarantine system. The issue is we have a larger outbreak in the city of Auckland, which is why we have high level of restrictions there.
Debate about whether it should go down to level 2, given that it has been those 12 new cases today. I guess some people were expecting that to be bigger.
Ultimately though, what we have seen is of those cases, we are contact tracing a large number of people. And they are groups of people who, prior to the identification of these first cases, so before we were aware of them, had attended churches, schools. And so we're very mindful of the need that whilst we have a small number of currently